Thank you so much, Michaela, and good evening, everyone. Thank you so much for joining Council President Dr. Jennifer Campbell and I this evening. We'd like to welcome you to our virtual town hall on COVID-19 vaccinations. Your time is incredibly valuable. We hope to have an action-packed hour. We have several really incredible panelists that I think will give you expert advice and information, both about the vaccine and its rollout here in San Diego. We will take questions that were submitted by email in advance to my office. We got quite a few, and thankfully, many of them are really duplicative. So I think we can get to most of those. And if we're particularly efficient, we'll be able to take some questions from the chat. So look forward to making this a really valuable time this evening. I know many of you have had questions both about the safety and efficacy of the vaccine, as well as its distribution here in our city. So we hope to answer many of those questions for you this evening. I want to start with some introductory comments, acknowledging that this is this panel and the Council President and I are working to navigate this massive, unprecedented process of inoculating our residents against the most devastating virus that we've seen in a very, very long time. As a result, of course, our economy is suffering, our schools are closed, thousands of San Diegans have become infected, more than 9,500 have been hospitalized, and nearly 2,600 have now died. Despite all this dire news, there is a glimmer of hope in that, of course, are the vaccines that have been rolling out since December. I want to remind folks that we have to be vigilant in stopping the spread of the virus by continuing to practice social distancing, wearing masks, washing our hands, and with those actions plus the vaccine, I think we can see a way out of this pandemic. But of course, if too many folks choose not to get vaccinated, we will not be able to achieve the herd immunity that we need. Because it won't be strong enough to provide the protections that we collectively have to have. So that's what I'm talking about when I say to folks, please get vaccinated. Do it for all of us here in San Diego. The Council President and I want to use our voices to express how critical it is to get vaccinated and to answer the questions you might have. Tonight, our experts will go over our regional vaccination plans, let you know the science behind the vaccine, and probably most importantly, assure you that it is safe and to encourage you to get vaccinated as soon as you are eligible. This is where I say, I know many of you message the office to say, you're ready, let's go. I want to get vaccinated. And I suspect our partners here at the county can help us fill in some of that information. Now, before I turn it over to the Council President to introduce our first panelist, I just want to give you a quick update on what the city itself is doing with regard to the vaccination program here in San Diego. I'm proud to say that we're partnering with the County of San Diego, my friend Nick Macchione and Dr. Wilma Wooten. We are partners in this effort to vaccinate San Diegans. We have trained 75 of our city's paramedics and EMTs to administer vaccines. We have staff that have been at the Petco Park Super Station providing vaccinations. Our city personnel has directly administered over 20,000 shots as a part of our comprehensive efforts to vaccinate San Diegans, which now number more than 250,000 of our fellow neighbors have now received at least their first dose of the vaccine. I'm pleased to tell you that at my request, the city was recently authorized by the state of California to be direct recipients of the vaccines. To date, it's been the County of San Diego, along with our private sector healthcare partners and public sector healthcare partners that have received the vaccines. Late last week, the city was given authorization to start receiving doses ourselves, and we are anxiously awaiting our first shipment of those doses. We plan to be additive to the county's robust response in making sure that we do our part to help vaccinate more San Diegans as they become eligible. And so with that briefing and those introductory comments, I want to thank, again, our panelists. We have some real all-stars here who have been extremely busy on the front lines of the pandemic since it began practically a year ago today. They're giving us some of their valuable time to make sure that you have the information you need to protect yourself, your family, your neighbors, and ultimately our entire region. So with those comments, I want to remind all of our panelists, let's be expeditious because we want to get the information you have out, but we also want to answer questions and have this to be an interactive forum. So with that, I will turn it over to my co-host, our City Council President. When you all in District 2 elected her, she ran on a platform of the doctor on call at City Hall. Could we have known it, how important and how lucky we'd be to have a physician here at City Hall helping to lead this effort. Council President Campbell, please take it away.
Thank you, Mayor Gloria. And thank you to our esteemed panelists for joining us this evening for this town hall. Can you hear me okay? Okay. Did you hear the beginning?
Yes, ma'am.
All right. So thank you so much. We in the city and county of San Diego are doing everything we can to combat this pandemic. Vaccinations against the COVID virus is the key. And we will end this scourge as soon as we can. We hope that very soon we will have enough vaccine so that everyone can get vaccinated. And for now, I would like to introduce our first panelist, who is Dr. Nick Macchione, who is MD, who is the Director of Infectious Disease for our county and the Medical Director of our Health and Human Services. Dr. Macchione.
Thank you, City Council President Campbell. You just promoted me. I've always wanted to be a physician, so I'm ecstatic. I am, though, next to the physician, San Diegan of the Year, Dr. Wilma Wooten, but I am the agency director, and I'm honored to be here. And thank you for Mayor Todd Gloria, who, like you, hit the ground running in our response between city county to this pandemic. I'd like to quickly go through some slides, table set, kind of what it is we're after. We talk about goals for us. So in this next slide, you'll see that we broke it down to what we have to achieve in this region. You'll see our population there listed, but the vaccine today is for 16 and older, so you'll see that's about nearly 2.7 million. And then our goal, a minimum, this is not just to reach, but to exceed 70%. This is established by the California Department of Public Health, and that represents 1.8, almost 1.9 residents. And with the vaccines that we have today, who have 2 doses, that's about 3.7+ million doses of vaccine. When we look at what we've accomplished to date, and then we looked at what the goal is starting today for over the next 150 days, goal given to us also by the state to achieve by July 1st, we would have to get to about 22,834 vaccines a day for the entire region. And we're not quite there yet. We've been ramping up. We're one of the leaders in the state, I'm proudly to say, but we have a long way to go still. And obviously, you'll hear this repeatedly, we need more vaccine. We're currently in our last 5-day average about 16,000. Just weeks ago, we were at 12,000. So we're climbing up. And that's because we're expanding our providers and hopefully with more vaccine. Next slide. Health equity is not a phrase. It's not a bumper sticker. It is an absolute driving force for us in the city of San Diego, for the mayor, city council president, as it is for our board of supervisors and us at the county and our healthcare partners. What you're looking at here is the Healthy Places Index that breaks it down by those of us in San Diego who have perhaps greater number of access to care, the issues, the social drivers of health, to those who have least amount. And you can see the color coding that the less healthier areas are their darker blue. As you look into the map itself, it'd be no surprise in some of the areas where you may see in terms of where our housing is, where we can see in terms of South Bay or the 78 corridor or parts of the eastern part of our county. The vaccine is for everyone, but we use the health equity as a force for us and a guidance of where we really need to first focus our efforts, obviously, in terms of what we've done for testing and now what we're doing for vaccine. Next slide. So the effort in doing this is numerous. We have to be thoughtful about how people, in terms of access and of convenience, driven by health equity. And so as the mayor pointed out, we have county-hosted event sites throughout. We have about now 11 of sites that are located. We call them pods, points of dispensing. It's an area where people are getting their vaccinations. And these are typically sites that are doing about 500 vaccines a day. And the county, in its first blush, really focused on the city of San Diego and South Bay. But we did go to East. People don't know, on January 1st, on New Year's Day, we opened up a site in Escondido, El Cajon, and South Bay, and also in Central Region in the city. So we have these sites. These are walk-ins, and they're all appointments, by the way, for these sites. Then you've heard a lot about the superstations. These are led primarily by our health systems. We now currently have 3. Tomorrow, we're opening our 4th one. Yesterday, we opened up in North, but our very first one was Petco Park. We opened then in Chula Vista as a second one, up in Cal State, and San Marcos is our 3rd one. And in Grossmont Shopping Center tomorrow will be our 4th one. There's a 5th one in the works that will be stood up in a couple of weeks as well. And these are doing 5,000 plus vaccinations per day at those locations. Petco is a drive-through. The others are different. They're walkthroughs. But bottom line, all of them require appointments. And so we also have then mobile teams working with our paramedics. And I'm really proud to say the city of San Diego, your fire chief stood up there at first blush saying, how can we work? The mayor was there with you all and us saying, how do we work together? And the paramedics have been phenomenal because they first vaccinated the vaccinators. They helped and vaccinate other first responders for paramedics and EMTs who are now vaccinators, not only in the city, but across our entire county. They're going out and they're going to sites to doing vaccinations, long-term care facilities, or also setting up vaccination sites in their cities. We have pods, vaccination sites at hospital campuses. We have some of our great community clinics, federally qualified health centers, Family Health Center, San Diego Health Center, and many others who have been doing vaccination sites. As I mentioned, the city partnership has been invaluable to us. That's pretty unique. And then we have others like the military. When you think about our population in San Diego, about a third is active duty veterans and family members of active duty veterans. That's a large population that's being vaccinated by the VA and by both Naval and our military hospital and the Camp Pendleton. They are doing those vaccinations. They're not reflective in our numbers, but we know we have a larger number of folks being vaccinated because of their efforts. And then we have pharmacies that are going out. And I'm proudly to say in San Diego, we have canvassed, and they've covered a great deal now of our long-term care facilities and our skilled nursing facilities. And now they'll be opening up at the retail pharmacies to offer also COVID-19 vaccinations. So lots of modalities because we have to have a lot of access points, obviously, for San Diego being a large, diverse county that we are. Next slide. This gives you the snapshot of some of the larger kind of venues. And as I mentioned, our county hosted pods. In January, started with 9. We are, by this month, getting to presently about 11, getting to about 12 to 13, adding more locations. I have a slide I'll show you quickly where those are. We have the super stations I mentioned. We start with 2. The first one proudly at Petco, where the mayor helped kick off with our chairman Fletcher. Today, and starting as of tomorrow, we'll have 5, and actually, 4, and the 5th one coming online within a few weeks in the month of February. And then you can see the hospital partnerships. We had 3 sites. Almost all our hospitals are stepping up, and we'll have a lot more in this month. You'll see in the below the capacity of how much we were able to do in the month of January. You could see where that number, 25,000 vaccinations average per day, exceeds our goal of the nearly 22,000 plus. Well, we like to do far more than 25,000. Our old goal is not to just achieve that, but to do far more because we like to end and get to that 70% well before July 1st. Again, assuming vaccines available for us. Next slide. So this is where we begin to map out. Actually, when you come to the county site, I know there's a lot of questions on making appointments, but you get to look at this site and it begins to overlay the Healthy Places Index, but more importantly, it overlays where the sites are, both the current and future sites coming online. And you can see those by the color coded. Should be no surprise where the concentration of sites are is where the greatest impact has had in our county. And yet more sites will even be coming on. And we're really hoping to light up this county map with more sites. So again, making it much more available to all San Diegans. And then on to the far right, I should mention Kaiser Permanente is also doing vaccinations. They covered 620,000 members, San Diegans, and so they're a big partner in this effort. So we're looking to work with them as they expand, and you can see the other, as I mentioned, pharmacies and other groups that are stepping up, including we're proud to have tribal nations and the tribal health doing vaccinations as well. Next slide. So currently where we are is all phase, we call phase 1A. It's all healthcare workers. That also includes the EMTs and paramedics, long-term care facilities, skilled nursing facilities, and those 65 and older. We'll get into some of the questions. I know the state has opened it up to some other groups. We'll explain why we're not there yet because we still have a way still to go in taking care of our elderly, our 65 and older, including those in healthcare. Next slide. And just looking ahead, and I think this will be coming into the questions, but I can't underscore enough. San Diego's leading in the state in the terms of the capacity, the amount we can do and where we can do it, but we need the vaccine. And I think you know there's a shortage going on nationally. Our state's doing the best that it can with our governor in giving vaccine, but we're asking to get it here in San Diego because we're getting it out as fast as we can receive. And I think that's a good sign of having that infrastructure. We're building up an army of vaccinators. These are nurses and paramedics. We're now training EMTs and doctor volunteers. We have a whole array of folks, pharmacists and so forth. But having the workforce matters immensely. But that's the third point. You have to have a location, and it's not any location. You have to be in the right community. And in doing so, the right venue. We know there's an interest in having more drive-throughs. So we're looking at where we can do even some more drive-throughs, as well as having large events in community-based and having big events like those super stations. Technology is immense here. We're blessed and cursed. We were one of the leaders in the state to move quickly because we thought that was important, and it is. But also, the technology wasn't there. We knew that. And we did our best with the systems that we have. They are getting better. The state has now stood up a system called MyTerm. It's not perfect. It's making improvements. But more importantly, we are working our way through those glitches, and they are, in getting appointments. But most of that is attributed not so much to technology, which I'm happy to talk about, but more to needing more vaccine for more appointments. Our data matters immensely of how well we're doing in our different communities for the people we serve, looking at it from a health equity lens, from racial and ethnic breakdown, very important for us on data that we collect. And lastly, I'll just say community engagement. Venues like this. We still know there are people hesitant and resistant to take the vaccine. Maybe all of you listening today are all bought in. Thank you. But there's still a chunk of San Diegans that are not sure. And we need to win their trust, and we need to continue to educate. And as we're promoting all the positive public health messaging that we have to do as we do the vaccination, we still need to get folks convinced and hopefully come and get their vaccination. And so I know we'll go more into that discussion. So things that we're looking ahead. So back to you, Council President.
Council President, I can grab it right here if you don't mind. Yes, we'll go. Thank you, Nick and Wilma, for that presentation. We'll go now to Dr. Chip Schooley, who's going to give us a presentation. He is the infectious disease specialist at UCSD. And then we have two more presentations, and then we'll do Q&A. Chip, over to you.
Thanks very much, Mayor Gloria. I'm going to spend just a few minutes talking about the science of vaccination and about the particular vaccines that we're currently working through. And I'm looking forward to your questions and answers. So I'm going to try to be relatively brief so we can get to the questions and answers as we go. So let me share my screen and see if we're seeing the screen as we should be. All right. Are we seeing the screen or the presenter view?
Seeing neither.
Okay. So I'm just going to talk about two topics. What's the theoretical construct behind vaccines? How do they work? What are we trying to do with them? And then I'll say a little bit about the vaccines that are currently available and on the horizon for this particular virus. We're jumping through. Okay, so normally when we become infected, if you just look at this yellow line, this is a line, just theoretical construct about how much of a virus or germ we have. We have an incubation period from the time we are exposed to the time we begin to be able to detect the virus. In a short time thereafter, our body detects the virus, and we begin to develop the kinds of symptoms that make us feel ill. After a bit of time, and this is really kind of our first responder and begins to keep the virus from growing as rapidly as it would like to, the most important part of our immune response is the so-called adaptive immune response. These are antibodies and killer T cells that you hear about. These are trained killers that are specific for the pathogens that we have to deal with. And the goal of vaccines is to change the battle from what we have the first time you see something, in which you have an initial response followed by an antibody response, which may only start a week or 10 days later, and gradually get control of the pathogen, to what we call a memory response, in which our immune response has already seen the pathogen and has a preview of what to do. And when that happens, our antibodies and our killer T cells get started much earlier, and they become much more pronounced. All right, let's see what's going on here. I apologize. Yeah, let's go on your slide and get to the, I think we were on, let's go to slide 3 on your slide. That's the last one. All right, let's go to the next slide, okay? So what's the goal of a vaccination? The primary goal is to prevent you from getting sick. It's not necessarily to prevent you from becoming infected, but if a vaccine is effective, it may also reduce the amount of virus that you carry and make it harder to transmit the virus to other people. So we're trying to protect both you and other people in the community with vaccination programs. Next slide. So how do these vaccinations work? This is a cartoon of a naive immune response and the way we try to get control of the pathogen or the virus with our antibodies and killer T cells. After a short period of time after infection, we begin to see the amount of virus in this case with coronavirus, in your nose beginning to grow in yellow. We then begin to get a primary immune response with interferons and other chemicals that are non-specific. And then the blue line, the most important one, is the one that shows the evolution of your antibody response and your killer T cells. But these are delayed for a week or 10 days. In the meantime, all you have is that initial response with this non-specific interferon response to protect you. Next slide. The goal of vaccination is to change that to a memory T cell response, a memory response in which your immune system has already seen this pathogen in the past, and a vaccine basically shows the immune response what to look for. So the immune response comes earlier, next, and in a much more pronounced way, next. And what that leads to is the pathogen, the virus, is knocked down really quickly at a time that you're not likely to get sick the second time you see it or the third time, and you're much less likely to transmit it to other people, accomplishing the goals that we've already talked about. Next. Now, the part of this particular virus that's really important is the viral spike protein. You can see it in this depiction of the virus as these blue and silver knobs on the top of the viral orb, hovering above the cell below. These spike proteins are really the attachment proteins that allow the virus to attach to the key of the cells and allows the virus to get into our cells. And the goal of our vaccines is to show your immune response what these spike proteins look like, so that when you actually are exposed to the real virus, you have a head start. Next. Now, what are the vaccine types that are out there? What do we know about them? Next. The two that are currently available are two vaccines that are both made with a new technology called messenger RNA. These two vaccines are called the Pfizer vaccine and the Moderna vaccine. Each of them has to be given in two separate injections, 3 or 4 weeks apart. And each of them are somewhat complicated to administer because you have to keep them very cold from the time they're manufactured until the time they get to to the place where they're used. They are very innovative because what they basically are doing are tricking your own cells into making just a little bit of that spike protein I showed you. And your immune system is standing around looking at your cells all the time, trying to see if something is unusual about one of your cells, sees that spike protein, and then recognizes the next time you see it if you get exposed to the virus. These vaccines are highly effective. They're highly safe and very well tolerated, as I'll show you in just a minute. Next. Now, the way we evaluate vaccines is we first do preclinical studies. And these are basically laboratory studies where we try to understand what parts of the virus are most vulnerable to our immune system. That's how we identify the spike protein, for example. Then we do some things in animal models to try to see if we can, with different types of vaccines, induce immunity to those weak and vulnerable parts of the virus. And then finally, we get to human studies. And the human studies with these vaccines have been extremely thorough, but also extremely quick. We have studied in the last year hundreds of thousands of people in the multiple vaccine studies around the world, progressing from very small studies to evaluate safety to the larger phase 3 studies that show us whether or not the vaccines prevent disease. Next. And these are the data from the so-called Moderna vaccine. In these studies to see if they're effective against prevention of transmission, half the people are randomized to get the real vaccine and the half are randomized to get a matching placebo so that the person getting vaccinated and the person doing the vaccination doesn't know which you got. And then you're followed to see if you have evidence of disease over time. And in this depiction, you can see that there are two groups, a red group and a blue group. The red group is the group that got the Moderna vaccine. And over time, as you watch this go from day 0 toward day 119, you can see the blue group, the group who didn't get the vaccine, continue to have new cases over this period of time. And after about 2 weeks, the number of new cases flattens out with the Moderna group. And most importantly, these dark spots on the lines are serious cases. The number of serious cases, with one exception, ceased. So these vaccines are about 95% effective in preventing moderate or severe disease, and about 99% effective in preventing severe disease. And by that, I mean people who need to be in the hospital or need to be intubated. So these are extremely effective vaccines. Next. From the standpoint of safety, if you just look at the left side of this panel, these are essentially local symptoms at the site of injection. And the point I want to make is that most people will have a sore arm that is mildly or moderately sore that lasts for 2 to 3 days. And the older you are, the less sore your arm becomes, which is a manifestation of us older folks don't mount as vigorous an immune response. On the right side of the panel, you can see some of the systemic responses, fever and fatigue and so forth. And you can see that in the lowest bar, just on the left side of this right panel, about 5 to 10% of people will have fever that lasts a day or two after vaccination, and it's a little more common after the second vaccination. But in general, again, these vaccines are quite well tolerated. Next slide. Now, why do you need to be vaccinated? Obviously, we don't want people to get sick, and we don't want them to die. So as I said to begin, we're trying to prevent disease. Secondly, we want people to develop immunity so they can't pass it down to other people to get to this herd immunity we heard the mayor talk about earlier and Mr. Macchione, the 70% or more needed. And increasingly importantly, this virus is evolving in front of us as it infects more people, and it's becoming more and more varied. And the more we let that happen, the more we're going to have to chase it with new vaccines. So it's important from the standpoint of having these vaccines continue to be effective, that while we're waiting to be vaccinated, we double down and prevent transmission of the virus by wearing masks and doing all the things we've been doing, so we don't give this virus a free pass on the vaccines we have right now, which are extremely good. And I'll stop right there and hope we can get to some questions. I apologize for the slide difficulties.
Thank you, Dr. Schooley. I'd like to introduce Dr. Tom Lawrie, MD, Chief Medical Officer at Sharp Memorial Hospital now.
Good evening. Thank you for having me. I will pose this question to Mayor Gloria, that if you want me to curtail my presentation, I'm happy to do so, and I can just give a 2-minute overview in the interest of time.
I think that's perfect. I think we do have some questions for you.
I'll avoid the presentation then and just say that when I was thinking about coming to this presentation, I thought about 2 things to try and convince people to get the vaccine. Not that we need to do that for the people here, but it's really 2 stories. One would be through not winding up in the ICU, and then the second way is so that you can protect those of us, my friends and family, my work family here in the hospital, who are being inundated with terribly sick individuals. The first is you don't want to wind up in the ICU, period. It involves ventilators and ECMO machines and dialysis machines and medicines to keep your blood pressure up and antibiotics and antivirals. And it's a terrible place to be. And some of these folks are being with us for weeks, if not months. And the recovery after that is long and arduous. So get the vaccine. Don't wind up in my ICU, please. Not because I don't want to take care of you. I will. We will all take care of you. But for your friends and families, do what you can. Wash your hands. Wear your mask. Socially distance. And then get the vaccine. I don't think I have to convince many of you. From my standpoint, we run it about across Sharp around our usual ICU census is maybe in the 60 to 70 range. For the last 7 months, we've been running our ICUs at nearly twice that. So we're around 140 patients across all ICU. That 140 level is what our normal ICU capacity is. So in the last 2 months, we've gone up another 50% above that. And this is not just Sharp, it's experiencing it. Scripps, Kaiser, Palomar, Tri-City, UCSD, everybody is going through the same thing. What you don't see, because we're so good at ramping up the surge capacity, is our ability to scale up. But we're riding just under with our current census what our surge capacity is. So just yesterday, we were basically at our capacity. We can probably scale up a smidge more, but anything you can do to keep that from happening is a great thing. Wash hands, socially distance, wear masks, and get vaccinated. Because if that number goes up even further, it's going to be very difficult for us to care for anybody who gets sick, a car accident, a heart attack, a stroke, any of the things, not just people with COVID. So in the long and short, do what you can. Please get out and get vaccinated, and I'll leave it at that.
Thank you for your brevity, Doctor. I know you've been busy as well as your colleagues. We thank you for what you're doing. We'll go to our last panelist before going to questions, and that is someone who was introduced to me by a dear friend who's now become a friend, and that is Dr. Cheryl Anderson, who is the Dean of the Wertheim School of Public Health and Longevity Science at the University of California, San Diego. Dr. Anderson, thank you so much for being here. Please proceed.
Thank you, Mayor Gloria, for having me, and good evening, everyone. It's really nice to be here with you. So the last few months have represented a really important milestone, right? We've been watching our frontline healthcare workers and other volunteers get their first doses, their second doses of the COVID vaccine. And after so many months of us being uncertain about what might come next, we can see a potential light at the end of the tunnel. As you've heard already through the presentations, the challenge really is how do we keep ourselves safe until enough of us have been inoculated and possess protective immunity. And so I just want to maybe speak a little bit to hesitancy around getting the vaccine to build on what Dr. Lawrie said. So, some of you may be thinking, wow, Operation Warp Speed, right? If it sounds too good to be true, it probably is too good to be true. And I want to emphasize that, given what Dr. Schooley covered earlier, we have reasonable assurance that the vaccines are safe. The systems that we use in this country to ensure vaccine safety have all been done routinely. The process, the mRNA vaccine process, is not one that just happened during the time of COVID-19. This is a process that has been tested now for decades, and we were well positioned to utilize it for the COVID-19 vaccine, and thus we're able to move quite quickly around the world to now be able to offer this. I also want to, touch on the fact that the things that I bring with me on my Zoom background here can't be said enough. And the big P word hasn't been maybe used enough here today, and that P word is prevention. right? So we, of course, would like for people to get vaccinated. If there's some hesitancy about being vaccinated, let's have a conversation. Let's talk about what some of those issues might be. Are the issues around safety? Are the issues around trust? Are the issues around, access? And while some people, may have come to this town hall tonight to learn all about how they can get access to the vaccine, how quickly they can get it, et cetera, others of you may have shown up because you are very concerned that this vaccine might confer some collateral damage for you. And so we'll answer any questions that you might have about that during the Q&A. But even after you get your vaccine, for those of you who are still motivated, and of course, as you heard from our county offices, we are working extremely hard to increase the rate at which the vaccines get delivered in this county. So even after you get your vaccine, please don't take a snapshot of my face so much as a snapshot of the things on the screen, just to remind us all that prevention is going to be key, preventing yourself from potentially picking up the vaccine, even if you'll get less severe disease, preventing yourself from inadvertently giving it to someone else if you're asymptomatic or if you have very minor symptoms, and let's keep everybody safe.
Thank you, Dr. Anderson, and thank you to all of our panelists. Let's transition now to the questions that were sent to my office in advance. If we're relatively efficient, we can get to some of the questions that have been placed in the chat. And feel free to place questions you may have in the chat. My team and I will do our best, along with the Council President, to write up the questions that we get to tonight and the ones we can't get to, and transmit them out afterward, just to make sure that we're being as responsive as possible. I think this is really an important time to build trust with the public, which is why we're here tonight. If we can dive in, I think the first question came from, again, a lot of these questions are duplicative. We got a lot of questions. Many of them are similar, and that's great because we can knock out a bunch relatively efficiently. The first was about the safety of vaccinations. I feel like all of the doctors here really addressed the safety concerns. I just maybe a yes or no question. Would Tom, Cheryl, Chip, Dr. Wooten, all of you are in favor, if you're eligible, get the vaccination. Is that fair to say? Yes to all? Thumbs up? Yeses?
Yes, absolutely.
Dr. Wooten is saying yes. Okay. Yeah, there was a number of questions. Is it safe? We've heard different things, but you all went to medical school. I did not. I really encourage San Diegans, take it from the doctors, not from your uncle on Facebook, all right? Get the vaccination when it's your time. Council President Campbell, I know you had a question about vaccines and their ability to prevent infection. Do you want to ask that question?
Sure. I have a couple of questions here from the public that we put together. As you mentioned, a lot were the same questions. So the question was, does the vaccine prevent us from getting COVID-19 after we get the vaccine? Does it prevent us from transmitting the disease to others if we're a non-symptomatic carrier? Is there such a thing? And do we have to continue wearing our masks and social distancing? Perhaps Dr. Wooten would like to answer that.
So I'll start out with the last question. Do we have to continue to wear our masks? And the answer is absolutely yes, we do. Number one, with the first vaccination, it's about 50% each effective. And then after the second, it's 95 and 94.5% effective, respectively, for Pfizer and Moderna. And it takes 2 weeks for the vaccine to become effective. So you still need to wear your mask, and we don't yet have herd immunity. So that's another reason to continue to wear your mask. Now, I know we have Dr. Schooley and other clinicians on the call, but from what CDC has stated, the vaccine prevents you from becoming infected. But as you heard, you might become infected but not get sick. Transmitting the virus, because you could be an asymptomatic carrier, the news is out about that. The jury is out about whether this can be prevented. And what we've been told is that additional clinical trials will be conducted to focus on that particular component.
Thank you.
Yeah.
Thank you so much. I had one more question from a bunch of people. We received a number of questions from caregivers who have elderly patients or patients who are not able to physically leave their home but still live at home. And they want to know if there is a way for them to get the vaccine. And Dr. Nick, can you answer that one?
Yeah, thank you, Council President. And that's why we're trying to focus right now on the 65 and older. To the point, the question raised or the comment, how do you get to a site if you're homebound? We are been working with our in-home support program, our folks that have medical conditions that don't allow them. That's been the priority right now. But there's some that may not be part of that program for whatever reason, have a medical condition. What we immediately tell folks is to make sure, one, that they are talking with their medical provider. A lot of the medical providers don't have vaccine, and so we're not asking them to bombard them with that, because we are trying to get more vaccines so we can give it to medical offices. We know that folks do make it often to their physician's office for their checkups and so forth, and that might be an easier way to get the vaccine. And that's why we're trying to get more vaccines so we can try to get it out and get it to the medical group practices, the physician offices, where that rendering of that care and vaccine would be much more, I think, conducive to folks that have a more challenging time to getting to, for example, at a super station or one of the walk-in sites.
Thank you, Nick. A question of, we just heard Dr. Wooten talk about the need to continue to wear face masks, a very common question we got today. Do we need to wear double masks in order to prevent or reduce the spread of COVID-19? Tom, Cheryl, Dr. Wooten, what are your thoughts on double masking?
Well, I personally agree with Dr. Fauci, and as more research and science comes out, either a double or tripled layered mask certainly decreases the risk of contracting the illness. So, and now with the doubling of the mask, if you use an inside, like a regular surgical mask, and then use one of the cloth masks over that, and it's being recommended, and it just increases it decreases one's risk of transmission or getting the virus if you are exposed to someone who's positive.
Dr. Anderson, Dr. Lawrie, you
maybe I'll just add one thing here is the proper wearing of masks, whether you're wearing a single mask or 4 of them, complete coverage of the nose and mouth. You see many people, their masks are on their chins, or, it's hanging off the side, or maybe it's in a pocket. And when in the presence of non-family members, meaning people that you live with, it's really important to cover those portals of entry and exit where you may be getting disease from yourself out to someone else, or someone else sending it over to you.
Tom, any thoughts on that? Being on the front line?
Yep, same idea. I think wear the mask. A mask is better than no mask, and as Dr. Wooten said, perhaps the cloth mask over a simple mask is better. We'll know in the next few weeks, I suspect, as we get more information. Hopefully Dr. Fauci will inform us all, and Dr. Wooten will inform us all, and we'll know a bit more.
I'm not a medical doctor. I know the mask belongs to your face. But you know where I know it doesn't belong? On the sidewalk, in the gutter, in the street. Please, for God's sakes, pick them up, put them in the garbage when you're done. Do not litter our city with them. I've seen way too much of that, and I appreciate the social conscience about wearing one. I want you to also have social conscience for the environment, dispose of them appropriately. A lot of questions, and I don't know who's the best to grab this one, around pre-existing conditions. There's a recognition from a lot of folks who messaged saying we recognize the need to prioritize senior citizens, but what about those who have pre-existing conditions? Can someone talk to when those folks may be accommodated, or do you think we'll stay on an age basis? A lot of questions in this regard, and that's from Robert and Kathy and Michael and Mary Carol, and there's a whole lot of folks here. I want to make sure they knew they got their question asked.
I'd like to start out with that question. Of the individuals that have died, 97% have had underlying medical conditions. And the top medical conditions include hypertension, diabetes, and heart disease. So any individual 65 and over, the majority of them have some type of underlying medical condition. Certainly hypertension is at the top of the list. So that's why the CDC started out in the state recommending 75 and over, and then 65 and over, because that age range has the greatest risk of complications due to underlying medical conditions. So it's inherent in the age risk factor prioritization.
What about for those who have a pre-existing condition like hypertension but are less than 65? Do you anticipate accommodating them, or do you think it'll continue down on an age basis?
Actually, it will continue. After we go through firefighters or emergency response, which includes firefighters and police, and then educators and caregivers, and then the third essential workers group would be food and agriculture industry. Because that's going to be the next group that the state is going to recommend, then it will also follow 50 to 64 years of age, because we are now 65 and over, and then 16 to 49 years of age that have high risk health conditions, and then it will follow the 16 and over, just anyone else who's not been vaccinated. So that is the state's recommendation that they will be proposing.
So you're telling us that the next in line would be those series of occupations you just mentioned, but there won't be a tier just for people with certain pre-existing conditions.
No, it will be an age that have high risk conditions, and then the age without high risk conditions. Again, it's going to be the 16 years of age to 49 years of age after the 50 to 64 years of age. Yeah. And
okay, I'm hearing you loud and clear. I think there's probably a lot of folks who don't like that answer, but we recognize you're just the messenger. You're not the one who decides this. And I do think there is value in some level of consistency. I am a little troubled by the number of folks who are looking to skip the line. There are a lot of questions about skipping the line. For Robert and some of the others who asked that question, I refer you to, I think it was either this morning or yesterday's newspaper discussing that process and how that's happening. Can we talk about allergies? There are a number of people referencing concerns about allergies, a whole host of different conditions, asthma, allergy to penicillin, et cetera. Does any of the physicians here have a recommendation for San Diegans who have significant allergies and the vaccine? Any thoughts on that?
Part of this came from the experience in the UK when the vaccines were first rolling out, and they had a couple of people who had what are called anaphylactic reactions or fainting reactions that turned out to be people who had allergies. They were treated with, they happened to be carrying EpiPens themselves, and they were treated with the EpiPens and did fine. And this is why we recommend that all people who get vaccinated hang around 15 minutes and be observed so we can deal with that. We're prepared for that at all the vaccination sites, and it's not a reason not to be vaccinated. And certainly somebody with asthma would be someone who would be at increased risk if they got COVID. So we wouldn't be opting out for those reasons. These are very rare events, but the vaccine centers are set up to take care of them.
And like Dr. Schooley says, it's which way we're watching people afterwards. Sorry, Dr. Wooten, to jump in here. I have allergies and asthma myself. I don't have an anaphylactic reaction. I don't carry an EpiPen. So I've gotten the vaccine without any troubles. I'll tell you, the reason I tell you that is not anecdotally, but because I wasn't concerned at all. There are people who carry EpiPens, and don't think we've seen many at Sharp, but we're all capable of handling those reactions. It's why we watch people 15 to 20 minutes after the shots. I think that should be not an issue, especially for these milder allergies, like you have seasonal allergies or an allergy to a medication for which you don't have an EpiPen. But it's something you can talk with your doctor about and see if you're and ask them what they think, and then know that if it were to happen after you get your vaccine, we're ready to take care of you.
That's really helpful news, Chip and Tom. Thank you for sharing that. That's for Lourdes, Mary, and Jeff, all of whom asked the questions about various iterations of allergies and whatnot. And I heard loud and clear, still, you recommend get the vaccination. There's protocols in place to protect you. And there's little evidence to suggest that that's going to be a reason to not proceed. But of course, contact your physician if you want to discuss that further. Nick, there are a lot of sort of processy questions about the vaccines. A lot of questions from folks who've received the first dose, but not the second dose, and they're concerned about being able to get an appointment for the second vaccine. I'm assuming these are at county vaccination centers. Can you talk about their concerns and anxiety about getting that second dose?
Yeah, thank you, Mayor. Which needs to be understood is when you come in and get your first dose, there is a second dose being held for that person. So even if you're hearing about supply issues, there's always a second dose held back by the state that then comes weeks later, depending on which of the two vaccines you received. What we are hearing to validate the concern is that you have to be sure you're registered, and this is not an individual, it's the provider, has to make sure that they're putting it into what's called the San Diego Immunization Registry. That is our San Diego registration system. Why? It's really important that we know what vaccine you received. Because if you happen to go to one provider and for whatever reason you can't get back to that second provider, because they should be setting up that second appointment for them, but in the case that they don't, we need to know what vaccine so that we're going to the provider who will provide the Moderna or the Pfizer. So we had some challenges initially, Mayor, absolutely. When we started the gate, some were doing the follow-up appointments, other were not quite yet. Those are issues that have been now worked out. So when you're going to get the vaccine, they already should be booking for your second appointment. What people don't realize also, for our county sites, for example, a week prior, you'll get an email or you'll get an announcement saying your vaccine's coming for your follow-up because we need you to come in to a certain time, and this is the location we'd like you to go, typically the same location you might have gone to. So yes, there were some of those issues initially. Those are the very issues we worked out, being with the many information systems we had, and then obviously the SAFE system that just joined us recently as a pilot site for us in San Diego.
Mayor, can I talk about the actual timing of the vaccine for the second dose?
You can say anything you want.
We don't want people to get their second dose earlier. The CDC says you can get it 4 days earlier, which will be 17 days for the 21-day and 24 days for the 28-day. But they've recently issued guidance that you can get the second dose as late as 6 weeks from the second dose date. So it helps to alleviate the anxiety that people might have that, I have to get my second dose, I have to get my second dose. CDC recommends you can get it as up to 6 weeks after the expected second dose date. So just want people to know that. But we definitely don't want them to get it earlier than they should. Agreed.
And the other thing, Dr. Wooten, that I emphasize to some folks is you get a huge amount of immunity with the first dose. It's like 80% immunity. So if, like you said, if you push back that date a week, 2 weeks from your recovery date, you're still getting a lot of protection as an individual, and we're also getting a lot of protection in the county itself. So,
got it. There are a number of questions that I'm just going to power through. There are comments about the lines and traffic at Petco, and I would say we're aware of those. We have both ACE Parking, San Diego Police Department, City Special Events, and a number of other folks that are out there. By virtue of its location, there's going to be traffic concerns that are there. My team, San Diego Police Department, working on it. I'll tell you that there are non-car versions, as Nick was mentioning before, that you can go to get your vaccine. I think many of you know MTS is now allowing free rides, and folks are able to walk up. They can bicycle up to the Superstation in downtown. A reminder, that's not the only game in town for getting a vaccine. You can go through your healthcare provider. You can go to the many other sites that you saw in Nick Macchione's presentation on the map earlier. So we know about the traffic issues that are there. I'd ask people to understand that this is a temporary situation, and actually let's be happy that people are availing themselves of getting the vaccine. Having no one down there would be a huge problem. We have heard comments about the sequencing. There are a lot of questions about teachers. You heard Dr. Wooten say, next on deck, our teachers got me. Did I get that right, Dr. Wooten? After powering out the 65s, we start going to some of those key professions, teachers among them?
Yes, teacher would be the second group. It depends on how much vaccine we have available. If we had enough vaccine available, we could open up all three of those categories, but it will depend. But we want to start with the law enforcement, emergency services, then teachers, then food and agriculture industry.
As a reminder, we can't arrest bad people through Zoom, right? We need to get our police officers vaccinated sooner rather than later. They don't have the luxury of working from home. Council President, I know you had some comments. I'm going to go, after you make your comments, I'm going to take some of the questions from the chat, and then we'll bring this thing home, if that's okay. All right? Go for it, Council President.
Thank you so much. Thank you. I think the main thing we see in the message tonight is, folks, please be patient. We have almost 3.5 million people in our county, 1.5 million in our city. And so far, the county has been able to give about 300,000 doses, which is quite amazing, given the fact that in December, we only received 27,000 doses. And just with January now passed, we've already gone up to 300,000. So as the government is able to get the production up, and as more vaccine comes online, we will be able to vaccinate more and more people. And I want to give you a little bit of my experience with vaccines. I've been a family doctor for 40 years, and I went to medical school at the University of Pittsburgh, right across the street from where Jonas Salk, in the virus lab, discovered and invented polio vaccine. That was in 1954, 20 years before I started med school there. Polio is now almost completely eradicated from the earth, and that's thanks to this vaccine and everyone using it. But polio virus is still around in the atmosphere, in the water, etc. And so we have to maintain our vaccinations against it. I was 9 years old when polio vaccine was invented, and some of my classmates had died from polio. 3 out of every 10 children who were infected with polio died. 30% of adults infected with polio died from it. Those who didn't die were usually left paralyzed. And the most famous person who was paralyzed by polio was Franklin Roosevelt, president. He became a polio victim at age 39 prior to being president, and his legs were paralyzed from it. The nation mobilized against polio, just as we're trying to mobilize now against COVID. They started the March of Dimes, which you've probably heard of, and just by donating 1 dime at a time over a couple of decades, they raised enough money for Dr. Salk to invent this vaccine. In 1954, when I was a kid in Colorado, we all lined up outside our elementary school because they had millions of vaccines ready for us to go. And we lined up, we got outside, and pretty soon the entire country was vaccinated. And I know that's going to happen here for us now. We just have to be a little bit patient. More vaccines are coming online. We'll get more in the county, and we're going to be okay. We have defeated many, many infectious diseases through the last 120 years through vaccines, and now we're coming up with new scientific ways to invent vaccines, and we can make them so much faster than the 20 years it took Dr. Trump. And so I urge you to be patient and know that with the help of all the scientists, doctors, healthcare workers, volunteers, I'm confident we can get this done. So let's make sure that everyone gets their vaccine to the coronavirus. We will be able to have herd immunity, which is especially good if 95% of us have been vaccinated. So remember that. Everybody needs to try and get this vaccine. It won't hurt you. It'll help you. It'll save your life. It'll save other people's lives. Thank you so much.
Thank you, Dr. Jen. A question from the chat was, why would we even consider the Johnson & Johnson vaccination when effectiveness is much lower than the Moderna and Pfizer? I don't know which physician wants to grab that one. Chip, Dr. Anderson.
I'll start. When the FDA issued the challenge for manufacturers to develop a vaccine for COVID-19, they asked for a vaccine that was at least 50%. the 63%. Johnson & Johnson is supposed to be 63% effective overall, but I read that it was 85% effective against the South African strain. Again, that's what I read. So I don't know if there's comments from others on the panel, but 60% is not bad. Keep in mind that most of our flu vaccines are anywhere between 40 and 60% effective.
I think we have to remember that even though you might still get infected with the disease, all of the vaccine data has shown so far that it keeps people from dying. To my knowledge, nobody has died after they gotten the vaccine. And to that point, nobody's required an ICU stay. So it's effective at preventing exactly what you don't want to have happen. Not that you wouldn't get infected with COVID, but you're not going to wind up in the ICU or die from it.
Yes.
We're coming up on the hour. Just the last kind of general, well, there's one quick question we have. Is it possible for employers to require proof of vaccination as a condition of employment? Anyone know what the answer to that is?
I don't know.
Yeah,
At present, none of the vaccines have had full FDA approval. They're under the emergency use authorization. And under that provision, you can't require vaccination or use of any drug. When they're fully approved, it would probably have to go down to the specific task an employee is doing. So, for example, we require people in the hospital have flu vaccines if they're exposed to patients. So those are the kinds of nuances we'll have to get to as we have more experience with the vaccine. Right now, our priority has to be getting people vaccinated.
interesting. And then the last question is sort of a bucket of questions around just making the process easier. Nick, you got anything you can share with the folks who are sort of expressing their frustration with what it's taking? I heard Dr. Woon a second ago, we need more inventory. I would agree completely. But any sort of promises of what's coming on in the near future that might take some of the things we're seeing in our social media feed of people's frustrations and hopefully making it easier for them to get the vaccine?
Yeah, thank you, Mayor. And I think you hit on it earlier as it relates to Petco. We offer more locations. It doesn't cater any one. And so more appointments. We opened up a superstation at Cal State at St. Marcos. Those 800 appointments were gone in 2 minutes. So there's a huge demand. And so that's the issue with the council president saying we have to just add as far much more capacity. I think that'll alleviate. The other is 211. We are really branching up 211 and the ability of people who don't know how to make appointments. Right now, we're focusing on the 75 and older, soon the 65 and older, where they can assist them when they don't have a means and getting them linked into an appointment. I think those are all the things we're trying to do to help people to deal with the frustration that I know everyone's dealing with right now.
Thank you. Dr. Anderson, I have come to lean on your advice and counsel so much in the last year. You didn't get a chance to really answer too many questions. Any final words before we wrap this up?
Oh gosh, this has been absolutely fantastic being with this tremendous panel with all the wealth of knowledge. I just want to say, Mayor Gloria, thank you for all that you've been doing to run this city. As Dr. Lawrie said, you've hit the ground running and continue to remind us that, we've got this. We can get through this situation. We are going to have to be in prevention mode. We're really going to have to think about others. But we can do it. And so to the great town of San Diego and everybody listening, if you are hesitant, let's have conversations about why our healthcare providers and our public health system really wants to better understand that. And to those of you who are so excited and can't wait for your turn to come up, as you can hear, the County of San Diego is doing all that it can to really increase capacity and to get us all taken care of. So thank you for the opportunity to be with everyone today.
I think that's a great summation this evening. Dr. Anderson, Dr. Lawrie, Dr. Schooley, Dr. Wooten, Nick Macchione, Council President Campbell, thank you all so much for being with us this evening. Listen, I'm not at the age group that can get the vaccine, but as soon as I'm available, I will be getting the vaccine. I hope all of you will do the same. I hope what you heard tonight is that it's safe to do it. It's effective to do it. It could be a lot easier in the near future as we work to expand capacity, and we'll do all that we can. But as Dr. Anderson just wrapped up, I know we have it in us, San Diego. A year ago, we didn't know what COVID-19 was. We've lived through a very difficult year, but now we have vaccines that are available. We're quickly getting our arms around this, and with some continued vigilance, we can defeat this, and we can go about rebuilding a city better than it was before. So thank you for your patience. Thank you for your time. And I ask you out to go now be advocates for this vaccine and for continued masking and following of the public health order. I ask you to give a thanks to our EMTs and our paramedics who are out there providing those vaccines, to city staff that are helping to direct traffic in locations, to city staff who are spending this weekend setting up vaccination stations. We have incredible public servants who are working hard to protect you and to serve you, and we will continue to do that until we defeat this virus. In the meantime, we thank you for your questions. Again, we will do our best to answer all of those and transmit them out to the constituents who ask those questions and post them on social media. And again, thank you for tuning in tonight. If you have any follow-up questions, please feel free to contact my office. We'll be happy to be responsive. Again, to all of our experts this evening who've been here, thank you for what you're doing. Thank you for joining your front lines. Dr. Lawrie, take back to your team at the hospital how grateful we are for their sacrifices in serving those who are sick with this illness and caring for those who are dying. And we will do more of these going forward because we have to make sure that everyone has enough information to make sure we defeat the pandemic. Again, thank you for your partnership. Thank you for tuning in. We'll see you all again very, very soon.